Hello friends, I'm Jyoti Hikot and today I'm going to talk about the types of adverse event. So let's start. In pharmaceutics, an adverse event is any unintended medical occurrence in a patient or in a clinical investigation subject administered a pharmaceutical product. And which does not necessarily have a causal relationship with this treatment. It is known as an adverse event. An adverse event can therefore be any unfavorable, unintended symptoms or signs, including abnormal laboratory finding or a disease temporarily associated with the help of medicinal or investigational product, and whether or not related to the medical or investigational product. um, the adverse event in a patient participating in a clinical trials must be reported to study sponsor, and if required could be reported to the local ethics committee. That are the adverse event categorized as a serious means a result in a death or a illness, or require hospitalization, prolongation of hospitalization, or even a dim life threatening conditions, result in a persistent of a significant incapacity, or a congenital anomaly, or a medically important condition that are known as a serious condition. It is a first adverse event. Then it is must be reported to the regulatory authorities immediately, where non-serious adverse events are merely documented in the annual summary sent to the regulatory authority. The sponsors collect adverse event report from the local researchers, and the notifies all the participating sites of the adverse event of all the sites, as well as the both local investigators and the sponsors also. The judgment of seriousness criteria of related to adverse events. This process allows the sponsors the local investigators access to a set. The data might suggest a potential problems with the study, and the treatment file. The study is still ongoing. Then we go forward to the our main thing, that is the types of adverse event. All clinical trials have a potential to produce adverse events. Adverse events are classified as a serious or non-serious, expected or unexpected, then study related, possibly related, or not study related. That are all the examples of adverse events. For example, while the study that the test effectiveness of blood pressures cup for a period of 10 minutes might be innocuous. The potential exists for the patient's skin to the irritated by the device. The patient in the study might also die during the 10-minute period. Both the skin irritation and a sudden death would be considered as an adverse events. In this case, the skin irritation would be classified as a non-serious criteria. The non-serious criteria, or unexpected and possibly study related criteria. The death will be classified as an serious and unexpected, unless the unexpected means unless the patient was already at the death door. The local researchers would use his or her medical judgment to determine whether the death could have been related to the study devices or not. Both the skin irritation and the death are unexpected event, and should alert the researchers to the potential existence of a problems with the devices in that means the for instance it could have a malfunction and shock the patients. Then we go forward to the The researchers would report these adverse events to the local institutional review board and to the sponsors, and await direction on whether to stop the study. And the researchers feels there is an imminent danger pause by the devices. He or she can use the medical discretion to stop the patient from participating in the study. An adverse event can also be declared in the normal treatment of a patient which is suspected of being caused by medications being taken, or a medical devices used in the treatment of a patient. That are all about the adverse events. Thank you.